health officials are facing a grilling on Capitol Hill. And today, fresh fireworks between Senator Rand Paul and Dr. Anthony Fauci.
So your desire to take
You're
down
absolutely
people...
incorrect. As usual, Senator, you are incorrect almost everything you say.
Well, no, you deny, but the emails tell the truth of this.
Now, you keep coming back to personal attacks on me that have absolutely no relevance to reality.
Do you think anybody has had more influence over our response to this than you have? Do you think it's a great success? Do you think it's a great success what's happened so far?
What happens when he gets out and accuses me of things that are completely untrue is that all of a sudden that kindles the crazies out there, and I have threats upon my life, harassment of my family and my children with obscene phone calls because people are lying about me. Now, I guess you could say, well, that's the way it goes, I can take the hit. Well, it makes a difference because, as some of you may know, just about 3 or 4 weeks ago, on December 21st, a person was arrested who was on their way from Sacramento to Washington, D.C. at a speed stop in Iowa. And the police asked him where he was going, and he was going to Washington, D.C. to kill Dr. Fauci. And they found in his car an AR-15 and multiple magazines of ammunition because he thinks that maybe I'm killing people. So I ask myself, why would Senator want to do this? So go to Rand Paul website and you see Fire Dr. Fauci with a little box that says contribute here. You can do $5, $10, $20, $100. So you are making a catastrophic epidemic for your political gain.
That exchange, as Omicron helps push COVID-19 hospitalizations to an all-time pandemic high. Nearly 146,000 Americans in hospitals with COVID right now. Double where we were 2 weeks ago. But some context here. These are not all hospitalizations because of COVID. Some are people who may have gone to the hospital for other reasons, but then tested positive once they were there. Some more context, and this is key here. Those being treated solely for COVID reasons are nearly all unvaccinated. CNN's Elizabeth Cohen is joining us now. Elizabeth, it's not all fireworks at this hearing today. There has also been some helpful news. What else are we learning?
Right, so there was lots of questions about testing and lots of questions about the isolation guidance. CDC's Dr. Rochelle Walensky doubling down, saying it was the right thing to do to tell people that if they were asymptomatic or feeling better, that they could leave isolation after 5 days as long as they wore masks because essential workers needed to get back to work. Let's take a listen.
We saw the growing surge of Omicron and took swift, science-based action to address the very real possibility of staffing shortages in hospitals and in other essential areas of the workforce, including schools, pharmacies, public safety, public labs, grocery stores, and other sites, where shortages could have and have proven to have dire public health consequences.
So the Biden administration also has promised more home tests, and they gave some details at this hearing. They said the first of 500 million tests will be shipped out this month, and the rest will be shipped over the next 60 days. Anna?
Elizabeth Cohen, thank you so much.